473, sir, page.
Okay. So under someone please read.
Mercor, so urine symptoms, albuminurea of pregnancy, nephritis. And
Okay.
in the generality section, it's given albuminurea in early pregnancy, forceps later, and at full term.
Madam, is it old edition?
Sir, it's second edition revised and enlarged.
Okay. So there is a first. Okay. I will read out what are the important points to differentiate for Mercor. So if you see under generality, we start from that. It causes tenesmus. So tenesmus is the leading feature in Mercor. Whatever organ it is involved, tenesmus must be there. Then what Dr. Patak said, it causes tenesmus of rectum along with tenesmus of bladder. So many of the times you will get both the conditions at one time. So this is more important whenever you prescribing Mercor in any of the case. That is my experience. Then if you see under modalities, worse after urination and stool. Same is with cantheris also. Cantheris will have more aggravation during urination, but the aggravation will continue after urination also. Then under, if we be okay, I have muted on. Okay. So if we go under urinary, intense burning in urethra, same is with this one cantheris. So intense is the word Dr. Patak sir is using. If we go across the rubrics under Patak repertory, you will see many rubrics which are adjective. So intense is the word which denotes the intensity of that burning. So intense burning in urethra, urine is hot. You can see the same hot burning urine in belladonna also. Belladonna, all discharges are mostly hot. What I learned from Dr. L.M. Khan sir once a time, this may be apart from our discussion, but sir always says the gushing menses which are very hot, then you don't need to think of any remedy other than belladonna in the cases of DUB or say metrorrhagia. Then radiating heat. If a patient of fevers comes to you and patient is lying on bed or you are just approaching to the patient, and if you get the heat from the patient and you can sense that heat, that is called as radiating heat. If you are getting radiating heat from the patient and patient is having other symptoms of belladonna, then belladonna can be the most perfect remedy in such a case. This was apart from our topic. Then hot burning past drop by drop. So urination will be drop by drop. It will be scanty. We have seen some remedies which are having profuse urination. This remedy will have scanty. Then bloody. Then frequent dribbling aggravated by sitting. Urethra bleeds after urinating with tenesmus, rectum, nephritis, albuminurea, pregnancy. So rest of the symptoms were of urinary tract infection. But if you want to compare albuminurea during pregnancy, then to prescribe Mercor, there must be tenesmus. And the most important concomitant in the last line in urinary, Dr. Patak sir writes sweats after urination. So this is the most important concomitant to prescribe Mercor you will get. If you know this concomitant, then and then you will ask your patient. This you can form direct leading questions which is against the principles of homeopathy. So if you open the page number 383 of Patak repertory, let me know the rubric. Sweats after urination.
So page number 383, sweat urination after. Merc is given, MERC and dot.
MERC and dot. So that is the reason I want to let you have your attention. If you read Mercsol, we'll go to the Mercsol under urinary section. Okay. It is only Merc remedy, no? It's not Mercor over there, na?
Yeah, sir, it's only Merc.
Okay, we'll open Mercsol. So, in Marsal on page number 469, frequent urging to urinate day and night with copious or scanty urination, urine causes itching, urinates more than drinks. This is second remedy we are getting, urinates more than drink. Albuminurea, urine black, bloody, burning after urination, stream of urine very small, dysuria, hematuria, painlessness. So is it there in Marsal in Patak Matramedica? Is it there?
No, sir. No, sir,
So
it's not there.
you need to add Merck, then you need to add C and dot over there. I have informed it may be the mistake by the publisher or printing press. I have informed about this mistake 2 weeks back only. So it may be the Merck or rubric. And I'm frankly speaking, I have used Merck or only before this. If tenesmus is there, albuminuria during pregnancy, you don't need to see other differentiating points. So got it? Okay. Then the next sub rubric over here, you can add, you can have one remedy, Cantheris. Someone please let me know the page number of Cantheris. Albuminuria during pregnancy. If you are getting Cantheris is one more remedy. It is there or not? Okay. Pregnancy during में नहीं है. It is not there under pregnancy during, but it's written under general rubric, albuminuria rubric. Cantheris is written in 2 marks. So page number 174, Dr. Varsha. So please open page number 174. Because whether it is or which is pregnancy or not, but if you are getting albuminuria with the grand characteristic symptom of Cantheris, then you cannot miss to prescribe Cantheris in certain cases. So here again, the differentiating point, urinary kidney region is very sensitive, urine burning, scalding with cutting, intolerable urging and fearful, tenesmus, dribbling, strangury, dysuria, then dropsy, renal colic relieved by somewhat pressure on the, this is for male. Then if you see under abdomen, again violent burning, वगैरह सब लिखा है. Okay. So when to give, consider Cantheris for albuminuria. So it is possible in cases of urinary tract infection. Up till now, we have seen the cases of nephritis. We have seen the cases of post-streptococcal glomerulonephritis. Then we have seen different indications, pathological indications of different remedies. But this is the remedy. The Cantheris, it has to be used when there is patient is having urinary tract infection, which is there on the report of urine routine and microscopy, and patient is having great burning during urination. So you need to have violent burning during urination and also tenesmus. The patient will have hematuria also in Cantheris cases. So you have to keep that thing in mind. Okay. So Merkur will have the aggravation after urination also, and after application of cold things or cold water. Then the next rubric, albuminuria septic. So there is remedy, carbovage. So what do you mean by sepsis? Think of sepsis and think of carbovage and think of albuminuria. If we combine all these three, you can get a picture. The patient is on the bed of hospital. This patient don't expect usually that this patient will come to your clinic and you are going to start this patient treatment. Consider this case in a hospital setup. So what you will get in carbovage, so general symptoms you will get. Please open page number, carbovage, page number 184.
183.
Okay. So on page number 184 under urinary, albuminuria, first line, then nephritic, septic, or from alcohol. We have already seen this remedy in where albuminurea, alcohol after abuse of, right? बोल गए क्या जल्दी?
Yes, sir.
हाँ.
Yes,
So
sir.
nephritis, septic or from alcohol. So this is the remedy. Or along with this, you will have urine suppressed in cholera. Forgot that cholera is not that much in epidemic in nowadays. Retain urine suppressed, retain from standing on cold pavement. So this is the common presentation you can get in your clinics if you dig into the history. I am living in Igatpuri where the rainfall is around 3,500 millimeter in each monsoon. So we do get such a types of cases on and off regularly, coming with this one nephritis or having problem with kidneys. And if you dig into the history, they can say that today only I have seen a patient who came to me that he was not in the habit of sleeping on the sleeping on ground, but he was sleeping on the bed cot, what we can say the wooden cot. But he slept on that and he got the fever with chills, and the rest of the symptoms were of this one classical of Rustox, and I have given him Rustox only. So this was just a case of 5 minutes. Every time you don't need to go with repertory, but many of times if remedy and causation and modalities are there and some observatory points are there, you can reach to minimum very fast in acute cases. That is what I have experienced up till now. Then the next rubric we will study. So we need to differentiate to have totality. I think I have differentiated many of the remedies under the rubric where there are lesser remedies. Rest of the remedies you also need to refer in mathematical like that only. I will now move to the next rubric, that is alcoholism, which is commonly used in our practice. So under alcoholism, there is Dr. Patak sir didn't write any remedy under that rubric. So I will first tell you the cross references to this rubric first, and I will compare those all cross references rubrics in a video. I will record a video and I will put that video on YouTube channel. Otherwise, it will be time consuming. So if anyone can answer, what are the rubrics which are similar to alcoholism in Patak report?
Sir, dipsomania.
Very good. Dipsomania. So dipsomania's cross reference is there. Delirium tremens. And the first rubric under alcoholism, second rubric under alcoholism is alcoholism, delirium tremens. So we get the rubric, cross reference rubric for alcoholism, delirium tremens को cross reference रहेगा delirium tremens. There is no remedy directly written under dipsomania, but cross reference already given in Patak, right? Next, what can be the rubrics which are similar to alcoholism? I think page number 92 you can see that delirium tremens rubrics. Page number 92 of Patak repertory. Is it there? Very good. So drunkard sheets, one more rubric. Sir, page number भी बोल दीजिए आप.
105.
Very good. What can be more?
Sir, can we think of liver cirrhosis?
No, madam. That is a pathological condition.
So
Can drink
food, wine aggravation, can we take it?
Food, wine, food and drinks, wine aggravation. But madam, I will just explain what is this word ism. All the words which are ending with ism, na, what we say Hinduism. So most of the attending doctors are from Hindu community. So ism is the thing where uh, you dwell into that thing. मतलब ऐसे होता है कि you are deep into that thing. So I am a Hindu, but if I say that if I'm promoting Hinduism, what does that mean? That I am promoting that ism. So ism में जो involvement होता है, that is very deep. matlab day in and day out I am involved in that thing. So wine, food and drink, wine में जो होगा ना, that will be for a time being only. So that cannot be a cross reference, but okay.
Okay, sir. Thank you.
अभी Oppo, अच्छा, I don't know the doctor's name. Oppo F7 is there. Food and drinks, alcohol aggravates, someone has written. So, sir, this rubric will be applicable if patient is having, for example, patient is having loss of memory, which is aggravated by taking alcohol. Patient is having some kind of dyspepsia or flatulence, and it is get aggravated by alcohol, then you can take. In cases where constipation is aggravated after taking alcohol, you can consider that rubric. I need okay. No one is able to reach to that rubric. One more cross reference is there, but I will give you a clue to read that one. If a patient comes to you who is alcoholic, right, and he is also a tobacco chewer. He is chewing tobacco since long and many a times, and he is also a chain smoker. So, what rubric you can consider? So this is the hint to reach to the one more cross reference rubric for
Addiction?
alcohol. Addiction. Is it
Addict.
there like rubric? Addiction.
No, sir.
Narcotics aggravation.
Please, ma'am, repeat. What?
Narcotics aggravation. Narcotics aggravation.
Okay, tobacco and smoking is not coming under the narcotic. No?
So can we think of stimulants?
Okay, stimulants. What will be stimulants? Stimulants will stimulate the system. मतलब if a patient, कोई बंदा अपने पास में बहुत सारे लोग आते हैं कि they will say if they don't drink tea at their time or they don't have a coffee, then they will get lethargy, and if they will take that thing, they will feel fresh. So they are as like stimulants. So this is the subtle difference what I am talking about. Ism is what we are involved in.
डिबेचुरी सर
नहीं सर, डिबेचुरी में ऐसे होता है कि डिबेचुरी वेरी गुड, आपने यू हैव टॉक अबाउट, मेरे डिफरेंशिएटिंग पॉइंट में है ये रुब्रिक कहीं पे अपने यही सेशन में. Debauchery, what is there in debauchery na? The patient is alcoholic along with his having extramarital. If he is married, he is having extramarital affairs, or if he is bachelor, he will have affair with multiple women, or if woman is there, he will have affair with many of the men. So debauchery में अल्कोहलिज्म के साथ ये चीज देखने को मिलेगी. डिबॉचरी अल्कोहलिज्म को नहीं होगा.
So
Okay, sir.
drunkards.
ड्रंकर्ड्स तो बोला ना,
Drunkards.
ऑलरेडी डिस्कस. ड्रंकर्ड्स है उस डर्टी
And
हैबिट्स
drugs
पेज
abuse of
98. Just 1 minute, ma'am. Dirty habits. Dr. Radhika Agrawal is saying over here on page number 98. Just let me see. So what is dirty habits now? I have used this rubric in one of my patients. He was having the habit that he was picking up his nose and he was eating that crust. Then one more patient I have prescribed that he was smelling. Both the patient I have prescribed sulfur along with other indications. One more patient I was having, he was just कपड़े के ऊपर से वो अपने एनस के पास में लेके जाता था. He was smelling that smell of stool. So along with other indications, I have prescribed that patient sulfur. So I have used this dirty habit rubric for that. You can consider Radhika ma'am this rubric in patients who are using toilet or washrooms and they are not washing their hands and they are directly drinking or taking some food. Okay. So you just consider कि एक patient है आपके पास में, one patient is there who is having multiple bad habits. He is taking alcohol very regularly. He is having tobacco chewing. He is smoking. So what can be the rubric? I will just give. I have given you the hint, and this is just for last 30 seconds. Otherwise, I will answer. Vices, Dr. YHB is saying, I have never used, I don't exactly know the meaning of this rubric. Ma'am or sir, I don't know. Okay, so one more thing is there. If you open on page number. So I will request everyone to write down these cross references in their book, because it will be just waste of your time also. So you will open page number 221 and see the rubric intoxication.
Intoxication, right.
Okay.
Hmm. Hmm.
So intoxication, you will have the state of a person in which he has consumed enough of alcohol or drugs or abusive substances to inhibit their mental and physical capacity. In spite of that, they are continually taking that. If the patient is only related up to alcohol only, if he is taking alcohol only, then you will consider the rubric alcoholism. If he is in the state more than alcohol, he is taking the abusive substances or the substances at one time he is consuming more, then you can consider this rubric intoxication. So these are cross references for this rubric. I will compare alcoholism, drunkards, intoxication. All these three rubrics, and I will record a video and I will put up on my channel. So next we will move to the rubric alcoholism. So what do you mean by alcoholism? That is most important thing to know to differentiate it from dipsomania and other things. What do you mean by alcoholism?
Yes.
Habituated,
Habitual. Okay. What more?
Addicted,
Okay. What more?
If you withdraw the alcohol, then the patient will have some symptoms or signs.
No, that is that is different thing. That is withdrawal.
withdrawal,
Abuse of alcohol.
Okay.
Alcohol
large amount,
dependence.
large
What-
amount of alcohol and not being
What-
able to stop.
Very good, ma'am. Who is this?
overuse, yeah.
Sir, I said dependence.
Okay.
Not
Okay.
able to stop. Yeah.
Okay. Who is this, ma'am? Not
Aarti.
able to stop. Okay. Okay.
Aarti, ba-
Okay, ma'am. So what quantity you will say large and what quantity you will say lesser? You need to label a patient. You will ask the patient what type of alcohol or liquor he is consuming and how much quantity he is taking. Then and then you can label it as alcoholism. No?
he
Okay.
might start getting some symptoms. I mean, not tolerable to him. Yeah.
Okay. Very good answer and participation from all. I do respect to all of opinions. So what is alcoholism? So we need to have a definition and the exact place, because what Dr. Pathak sir was MBBS student. So he was very cautious to use his words in repertory or in mater medica. If he writes one word, and he was a disciple of, he was a follower of Bogar sir also. So regularly drinking large amount of alcohol, you are right. Then not being able to stop this alcohol despite of having adverse effects in his social life or occupational or his health problems. So patient is consuming alcohol, large quantities of alcohol in spite of this thing. So there is definition also I will compare in this my next video. So then the sub-rubric next coming, we have understood the alcoholism word. Then the sub-rubric comes alcoholism acute. So what is acute alcoholism? So can anybody explain what is acute alcoholism? So we have seen alcoholism, na? patient is taking large quantities of alcohol in spite of having adverse effects on his social, his occupational, or his health life.
Maybe it's the hangover.
Sir,
Maybe
pardon?
it's the hangover. When you're drinking the alcohol and you have effect.
Hangover.
Sir, hangover तो next day होगा ना. Acute alcoholism है ना. It will be during the phase when patient is under intoxication. So what is acute alcoholism? So it is the thing, acute alcohol intoxication which causes behavioral, neurological, pulmonological, cardiological, then gastrointestinal and metabolic effects. So once I have considered this rubric in a case when the patient was brought to me who has drunk heavy quantity of alcohol and he slept like nothing, and then he was very difficult to arouse when the relatives brought him to my clinic. Then he was having the heart rate of more than 140. He was sweating fully, and he was having no control what he was talking. Means the sensorium was very disturbed. So this is the case where you can think of the rubric acute alcoholism. So there is a rubric, there is a remedy. Which are the remedies over there in this rubric, alcoholism acute? Do you understand
Aconite,
what is acute
belladonna, and opium.
alcoholism?
Aconite, belladonna, opium.
Opium.
Okay, so all the remedies over here are the remedies we can consider the having violent effects or sudden effects, right? Right or wrong?
Yes.
Okay. So page number, you will open page number 6 of Patak Matra Medical. Aconite we are taking.
ये बंदा नवा रखे
Somebody unmute yourself and read page number 6.
Symptoms are acute, violent, and painful. They appear suddenly.
Yes.
Mind is affected by fright, shock, vexation.
I will just stop you, ma'am. We need to
Yes.
differentiate now. We need to differentiate aconite and belladonna.
Yes.
Firstly, huh? So what's there in acute? Its symptoms are acute, violent, and painful. Okay, they appear suddenly, remain for a short while. Suddenly आएंगे, थोड़ी देर रहेंगे, like a big storm, which soon blows over. They will come suddenly, they will stay for some time, and they will disappear. Okay. Then next thing we'll see frantic scream से आगे पढ़ना आप अभी. माइंड में चले जाइए.
हाँ.
Mind, great anxiety. Then the fourth line will directly come to besides himself.
Yes.
This is the rubric we are using when the patient is in very agony and when the pains are very much in
Yes.
those cases. So this is the rubric in besides himself is the rubric, and if aconite is not there in that rubric in Patak repertory, then you can add this remedy over there. Frantic prop intensive often with fierce screams. So what will be the picture in acute alcoholic? So this picture, he will have fever, he will scream, he will moan, he will gnaw the fist, then he will bite the nails,
Bite his
and
nail.
he wants to die, and he will have fear of death. Okay.
Yes.
Then his abdomen will be sensitive to touch in these cases. If you are approaching to his abdomen, the abdomen will be sensitive to touch. And what type of generally it is you will get mostly to prescribe aconite. Usually this patient will visit your clinic in night time, or this phase of suddenly coming and going the acute Acuteness is going and coming suddenly, but it's get aggravated at night. He will feel better in open air. You need to ask every time the patient that whenever they are leaving their home to your clinic, what was his behavior during that journey for that 5-10 minutes or say half an hour when he was in open air. Then fear and restlessness are very marked in apneic patients. And palpitation, what I said to you that in one of my case, palpitation. So what will happen? He will have significant tachycardia, and apneic patients usually present with the anxiety in heart. Okay. So next, Dr. Naila is the amount where he loses control, but still excessive desire to drink. Okay, okay. So next rubric will next remedy will compare belladonna. So we'll go to page number 113. So in belladonna, the action is on the brain. Belladonna's action is on the brain, right? Second line, its action upon the brain causes furious excitement, perversion of special senses. So perversion of special senses are how many special senses we have?
5,
Very
sir.
good. So there will be perversion of special senses. This remedy is also there in rubric. Senses perverted, then senses special, perverted or special senses perverted is the rubric there in Katak. This remedy is also there. So its action is on brain, then perverted special senses. This remedy, belladonna will act better in intelligent person who are excited, noisy. What the rubric we learn in what Segal method, noise inclination to make noise. So you will get belladonna under that. So the presentation of belladonna will be different. He will not be anxious. Belladonna will also have biting, striking, and tearing mania during acute alcoholism. He can spit on faces of others, and then he will, if you ask the relatives what you do in such acute situation, then they will tell you that if they offer some food to the patient, he will get little better. So this is the presentation of belladonna, what you can think of in acute alcoholism. Next remedy comes under this is, sorry, I just wanted you to highlight one more important mental point. What I talk about no, belladonna people are intelligent. So you can see the line in mind section that intelligent and plethoric person who are jovial and entertaining when well, but violent when sick. So this is the very much true line about acute alcoholics or alcoholic patients about belladonna. They are very well when they are not under intoxication. Once they are drunken, they can be the very different person. The wives of such a persons will come and tell you in your clinic that Dr. Saab, he is very much a gentleman when he is not taking alcohol. But if he takes alcohol, then you cannot see him. Then I need to ask
So,
you, page.
Sir, it is
Madam.
mentioned, no, an angel when well
Yes,
and
yes,
devil
yes.
when
That,
sick.
yes,
That is
yes,
what
right.
it means, right?
Yes.
Yeah.
So this is the clinical presentation in alcoholic. So next remedy comes under this is opium. That is on page number 530. So if you open, then Dr. Patak sir, it affects mind, nerves, and senses. Insensibility, leading to insensibility of nerve, a kind of negative states, loss of power, concentration, self-control, and judgment. So self-control and judgment means they need to carry by the family members to your clinics, and they don't have the judgment. What type of judgment? This is sensorium altered. What we can say to the time and pace. तो टाइम और पेस के बारे में उनका सेंसोरियम अल्टर्ड रहेगा. दे आर स्टूपिड स्लीप अकॉर्डिंग all complete. Wants nothing, says nothing. They will be in just silent mode. So this is exactly the opposite state of belladonna. What we can see, they are indifferent to pain and pleasure also. So this meeting will end in 1 minute. If you want to continue, we can. I think we can join after 8 to 10 minutes because it has already finished 2 sessions. If you are
Thank you.
ready, you can let me know.
Thank you very much. We will do that. I need.
Okay.
In this situation of the acute situation of the drunkard, could we think about nux vomica also? Because certainly the side effect of alcohol and nux vomica will be antidoting, and if using the very dirty word while this person is drunkard.
So you
In
have
that
already differentiated. You have already differentiated Naxomica